21st of March. I had a bit of a goldfish moment there. And today you're joined by myself, Tasneem, Peerjee. I am a midwife, and I've got Helena, who is also a midwife and specialises in home birth, with me to talk about becoming a mother and sort of the questions that I have around what do women expect in their journey to welcoming their babies into the world, especially when it comes to our faith within spirituality. And there's lots of information available wider than what our community accesses, and I want to be able to share that with you all during these sessions that I'll be doing with Ramadan Radio. So if you want to send in a question, if you can contact the studio line on 0116 482 2086, or you can SMS or WhatsApp them. So you can text or WhatsApp on 077 488 55055. So before we get started, I thought I'd introduce myself because this is my first ever sort of appearance on Ramadan Radio. I used to call in when I was younger, and I used to pray Surah Fatiha, which for Helena, it's a chapter within the Quran. And I used to always sort of send out my salams to the wider community and the whole world. So this is a bit of a sort of really surreal moment. But I have been asked to come on and share my experience and my knowledge, and other people's experiences and knowledge around childbirth preparation, because especially within Leicester, we don't have a lot of widely or readily available information available to women within the local community. And not because it isn't there, it's because sometimes things need to be looked into or looked for, and it may just be that kind of isn't well known. So we'll be exploring some of that. I myself have 11 years of experience as a midwife, and when I first qualified, I worked within hospital setting, I've worked within research, I've worked within education. I currently work within the community setting. So I am a practicing midwife. I am an honorary lecturer at the University of Leicester, and I am also a private practitioner, and that's been sort of collated over the past 11 years. I also do a lot of community work in some ways. I try and dedicate my time to give mothers and families support in various different ways, and I'll be talking about that during my shows here on Ramadan Radio. So I'm going to introduce my first guest for today, and this is Helena. Helena, welcome.
Thank you. I
know you're probably as nervous as I am, because this is both, well, I don't know whether you've been on before. You haven't, have you? This is Helena, and today we're going to be talking about home birth. And the reason I wanted to talk about home birth, especially for the session today, is because a lot of women don't know that they have a choice when it comes to giving birth.
Absolutely.
And Helena, why don't you tell us a bit about yourself?
So I'm Helena Bull. I'm a member of the home birth team and have been since it started in 2017. I've been a midwife for nearly 24 years now, which feels like a lifetime. It is a lifetime. So I've been lucky to be at the birth of many, many, many babies, which is fabulous. The home birth team is part of the NHS. So it's a service involved in the NHS. You don't have to pay for it. There's about 20 of us in the team, and we're based at Glenfield Hospital, but we cover the whole county, including Rutland as well. And we care for women who choose to have a home birth. So we can care for people from pregnancy booking, or if they decide later on, we can take them into our service then. We care for them through pregnancy, through the home birth, and then after the birth. Even if the birth ends up in hospital, we still do the postnatal care as well.
Brilliant. So it's very much a continuity of care model.
Absolutely. So our midwives try to stay in the same areas. So the midwives that cover, we're in LE2 at the moment, aren't we? So Sam is a midwife who covers LE2. LE5 is Ruth and Natalie. And we try and see the women, particularly antenatally, we try and see those women. The same midwife tries to see those women. So you get to know your midwife a little bit. We get to know you. We can help you prepare for your pregnancy and birth a little bit more with a bit more personal interaction.
Brilliant. And with the home birth team in Leicester, you are the UK's largest home birth.
I think so. We don't
home birth service. Sorry.
Yeah, there isn't actually a register of NHS home birth services or anything like that. So we think we're probably the biggest. It's not means we're the best or anything like that. I wouldn't like to blow our own trumpet, but we're definitely the biggest team. There are about 20 midwives in the team. We've also got an admin in our office. Daniel is the only male who works in our team, so he's learning a lot.
I bet.
And we've got a team lead called Annabelle as well. And we, as I say, because we cover such a wide area, because Leicester hospitals are the only hospitals in Leicester, we cover the whole area that they cover, basically. So that's why we're such a large team.
Brilliant. And I know from the work that I do, the Leicester Hospital's home birth team has been such a widely recognised service as well, and that's because you guys did the most amazing thing during COVID, didn't you?
We did. We were able to keep going. I mean, we were very lucky that we had good management support to keep the service going, and it helped us take births out of hospital, which helped us get some amazing home birth numbers, and people who wouldn't have considered home birth before didn't want to go near a hospital, which is completely understandable. So yes, we kept going where most home birth services in the country stopped, and midwives were redeployed back into hospital to deal with the crisis in hospital, basically.
So I'm going to start off there then. What is the difference between a hospital birth and a home birth?
Okay, so if I'm trying to very quickly describe the difference, it's your own cup of tea, your own bed and your own toilet. And that makes so much difference. So sometimes some people need to be in hospital. Absolutely they do. But if you're healthy and well, being at home is very safe, it's comfortable, and your body works better when you're comfortable. Labour happens better when you're comfortable and less anxious. So being at home with your own things, your own TV, your own blanket, you can get in your own bath or your shower. You're not having to share facilities. You're not listening to somebody else giving birth next door. It's a much more calm environment. You can eat your own things. Your partner or your birth partner, your family can be there. It becomes an everyday miracle. It's something that happens in your home, and you wake up one morning and you have a baby that day and you go to bed that night, and it's just an incredible experience as a midwife, but as a mum who's had a home birth as well, to have that baby and you're going back to bed now and I've got a baby, and it's amazing, and it's not such a massive transition to motherhood, but because you've not had to go into hospital, you've not been separated from anybody, you've just sort of slid gently into motherhood, which I think is a wonderful thing. It's
also the management of labour itself is different, isn't it?
It is, yeah. So we don't have any doctors at home, but midwives are the experts in normal birth. So we've been doing it for years and years and years. Myself, I've been doing it for 20 years, being at home birth, and most of my colleagues have been doing similar. So we bring everything we need for a birth. Excuse me. We bring everything we need. We don't ask you to provide anything. There are some things that we recommend for comfort, but we bring the emergency stuff. We do bring emergency equipment. We don't use an awful lot of it. We don't use it very often, but we do bring what we may need in an emergency. Ask me the question again, because I've got waylaid.
What is the difference in management?
The difference in, yes. So we are cautious at a home birth. So we are closely monitoring what's going on, but not too much in your face. We try and sit out the way, let you do your thing, labour how you want to labour, but we're closely monitoring what's going on. And because we're there all the time, we're not being pulled to another room, we're not being pulled to care for somebody else. We can watch your labour progress. And because we've seen so many labours progressing, we are able to watch what's going on and see labour unfold, and is this unfolding as I would expect it to? And if it's not, that might be a point where we'd have a conversation. Maybe home birth isn't the right place to be now? Do we need to get you into hospital? Is there a query about what's going on with baby's heartbeat or your temperature, or all the things that we're gently looking at, having an overview of. So if we feel something isn't right at home, we would be then recommended going into hospital. But while it's going well, we just let you do your thing. Your body will give birth. You don't need anybody to tell you what to do to give birth.
And I said this to you, so we were having a bit of a practice go before we got started. But I was saying to Helena that actually one of my turning points in my mindset and my beliefs as a midwife. So I sort of learnt the theory, and as you do as a student, you learn the theory about birth, and then you go and work in these systems which make it sort of difficult to practice like you have been taught. And then I remember you directing me at a birth to just sit on my hands and, you know, watch and wait. And I reflected on that a lot, and that made me sort of question what I was doing and the kind of midwife I wanted to be. So I have to thank you for that.
You're very welcome. Thank you. It's lovely to hear that. Really lovely to hear that.
100%. Like, I remember that home birth, even if you don't.
I'm sorry. I've been at a lot.
And that made it really sort of surreal for me, because I thought, what am I doing? You know, why was I so adamant on doing assessments when they weren't necessary? And that's something, probably one of the things I really want to highlight to the people listening, is that just because something is getting done doesn't mean that it's the right thing to do. And always question what's going on and understand how your body works in order for you to then know when you need that particular intervention, I guess.
Yeah, absolutely. I think, like, for example, when it comes to vaginal examinations, the hospital recommends 4 hourly vaginal examinations, but you always have a choice. Nobody can touch your body without your consent. So I can't say, well, I need to do a vaginal examination. I can say, I think this would be a good idea. And I think it's, from my point of view, the way I practice, I like to say, right, this is what information I will get from this vaginal examination, and this is how it will change the care I give. If it's not going to alter the care I give, or it's not going to inform the care I give, there's no point in doing it.
Yeah.
So and if I can then explain that to somebody, then they will hopefully understand where I'm coming from, and they can make their decision based on that information. So I think it's all about having good conversations with people and explaining things. But definitely being prepared for birth, understanding the basics of birth and how your body works really helps you to understand. Then when something needs to be discussed, you can then have that conversation with a little bit of knowledge. But it is our job to make sure you get that information in a way that you can understand.
Brilliant. So with home birth, what would someone expect you to bring to a home birth?
Wow. Okay. So
what kit do you carry with you?
We carry quite a lot of kit, so you do need a little bit of space. We have a big red suitcase which has got all of our emergency drugs in. It's got gloves, it's got paperwork, it's got birth pack, a sharp spin, a torch, a sonic aid to listen to baby's heartbeat. It's got a hat for baby. It's got gloves. It's got aprons. So our suitcase has got lots and lots of things in that. So we're in and out of that all the time. Some of the things we use a lot, some things are in there for a long, long time, and we have to change them because they've run out of date because we've never touched them. But they're there just in case we need them. We also bring gas and air. So we bring 2 canisters of gas and air at least, and that, depending on how quickly you're using it, but lasts for a good couple of hours, usually, the gas and air. And often there's someone else around who could bring more if we needed to bring more gas and air. So we have that as well. Most of us in the team are aromatherapy trained, so we can bring our aromatherapy stuff with us as well. So we can use that to help you with labour, to help you keep calm. Some of the aromatherapy oils can help with contractions a little bit as well. So we have aromatherapy that we bring. We also bring a bag of resuscitation equipment. And we always set up resuscitation equipment for baby because I'd rather be prepared. We don't want to have to be getting it out if there was ever a problem. So I always say to people, if you see me getting the resuscitation equipment out, it means your baby's about to be born. It doesn't mean I think there's going to be a problem.
Absolutely.
So we have that set up as well, and we don't use it very often. It gets packed away again, but it's there if we need it. We bring our laptop. So there's 2 midwives that come to a home birth. So one often does the paperwork, the administration side of it tucked out the way, and the other one does the care mostly. So they're listening to baby's heartbeat. They do your blood pressure, support you where you need it. We also have birth pools that we bring. So one of the midwives can be getting a birth pool up and getting that sorted.
You offer TENS machines as well,
we've got TENS machines that people can loan from us. So we just ask for a small donation for them, just so we can then keep that supply going if any of them become damaged or anything like that. So yeah, TENS machines and birth pools we have that you can loan from us.
Brilliant.
What else do we bring? That's about it, really. It's quite a lot of stuff.
It is. And it's because you've got to be prepared for any eventuality, really.
Absolutely. And we train every year. A few months ago we had a training at my house actually, and we blew a birth pool up. Did we? I don't know whether we blew a birth pool up actually, but we had a whole birth scenario, and Annabelle, our team lead, was pretending to be in labour and all the things that we were dealing with. And we also had an ambulance there on standby. So we actually had the ambulance crew there, and we did everything in real time. So we are practice in case we're needed to do something that is unexpected. So we're ready if things do take a turn that we don't expect. But our job is to keep an eye on things and make sure they're staying well. And if they're not quite right, recommend going into hospital.
And with the ambulance service, how does it work with having home birth? So if at any point a transfer was needed, how would that be arranged?
So if we're with you and you're in labour, we felt, so for example, what have I done? I've done a transfer recently for baby's heart rate was going up a little bit more than we would like. And so we have some guidelines around heart rate. And my colleague and myself actually thought, you know what, this doesn't sit right with us. It feels like there could be something else going on here. So I called for an ambulance. We declare an obstetric emergency. So an obstetric emergency basically is the same as a heart attack. So it gets the nearest ambulance to you quickly, and sometimes it gets a fast response car as well. Sometimes we don't need that, but usually what we need is an ambulance to get us to hospital. So even if it's not a desperate emergency now, someone's not bleeding or anything like that, it's just something's not quite right, we don't want to be waiting at home. So we do always transfer as an emergency. A midwife always transfers with the woman in the ambulance, and then partner, we usually suggest they follow along in the car, bring the car seat, bring the hospital bag. We always say to women, even if you're planning a home birth, have a hospital bag packed, or have a bag packed, let's say, because then after you've had a baby, when we need some pants and a pad and all of those things, your partner's not having to go and dig through your underwear and bring something inappropriate down.
Absolutely, because sometimes partners can be apprehensive of this process as well, can't they?
Absolutely. It's often partners who are concerned. They feel like they're going to be more responsible at home, but you're no more responsible when the midwives get there than when you are in hospital. You are responsible for providing tea for the midwives. That's very important.
No cake?
Well, cake, yeah. We accept anything, although, there's a lot of biscuits and cakes involved. Maybe a bit of fruit might be quite useful sometimes.
Keep you going.
Yeah.
Need the energy.
Yes.
With partners, what would your key message be? So if a woman was absolutely your textbook patient for a home birth, what would you say to an apprehensive partner?
So there was a midwife, I'm not sure where it's come from, but I've heard it said, and I use this now, but when you're on delivery suite, it's like a duck pond. It's quite busy. There's a lot going on, and there's people watching what's going on. But if a fish bob to the surface, you're not going to notice that because it's quite busy. At home, it's really calm. It's like a mill pond. It's silent, it's still, and there's people watching, 2 people watching. If a fish bobbed up, you would see the ripples of that. So we're looking for tiny little things that aren't quite right. So safety-wise, it is at least as safe as being in hospital. So that's often what partners are concerned about. Is it going to be safe? So we always try and reassure that it is going to be safe. And I think just sitting and talking to us and knowing that we're not just turning up with a pair of rubber gloves, we are actually really well prepared and really well trained. I think that reassures an awful lot of partners. But also for partners, you're not sitting in the corner of a room thinking, well, I don't know what to do and I don't know where I can go to the toilet and I really would like a cup of tea, but I know they're really busy. So you've got your own space. And sometimes women are quite capable and actually want a bit of alone time in labour. Some women do. Everybody's different. Or they might have family, sisters and whatever helping them as well. So sometimes dads will go off. My husband was building the cot while I was in labour at home. So you don't need to have... It's not so intense. You're not all in the same room and waiting for this to happen. You can have the TV on. The football might be on. You never know.
Absolutely. And that's something that a lot of people don't realise, because in a hospital confined to one room, you can't go anywhere.
No.
You can't just sort of think, well, you know what, I just want to stretch, I want to go for a walk. You can't walk off the main sort of maternity.
You have to buzz to get in and out and all of those things, yeah.
And all of that then affects, as a midwife, and I know that you're one of the most holistic midwives out there, it's all about hormones.
It really is all about hormones. Yeah, the hormone that really controls labour is called oxytocin. And oxytocin is the hormone of love. So it's the hormone when you fall in love with someone, there's lots of oxytocin in your system. When you look at a really cute animal and you just want to squidge the animal, that's oxytocin in your system. And oxytocin causes contractions. It causes your milk to flow. So we want to promote oxytocin. And oxytocin likes it when it's dark and quiet and cosy. And think of all the things when you fall in love with someone or when you just feel really good. That's oxytocin. So we want to have that same kind of thing. So dark, candles, twinkly lights, warm water, blankets, all of those kind of things really help labour to progress. And adrenaline kills off oxytocin. So we want to get rid of the adrenaline. So we don't want anxiety. We don't want to be able to hear somebody next door having a baby. We don't want to have, I'm going to this new place and the lights are all on and there's a doctor, I don't know who's going to come into this room. So that's why home birth tends to work better, because your hormones are allowed to do their thing.
So I'm going to read you some stats and I want you to tell me if you agree with me.
Okay.
Because these are stats that if you're planning a home birth, you're 40% less likely to have a cesarean section.
Yep.
You're 50% less likely to have an assisted birth through forceps or ventouse, which is the suction cup. You're 70% less likely to use an epidural, which is interesting. 40% less likely to experience a 3rd or 4th degree tear. 60% less likely to receive synthetic oxytocin. I'll come back to synthetic oxytocin. 75% fewer reported maternal infections, so less likely to have an infection and less likely to have a postpartum hemorrhage.
Yep. Yes. So people will say, well, you're at home, you can't have a cesarean, you can't have ventouse, you can't have forceps. But actually what those statistics say, I don't know the exact numbers, but what those statistics say is that if you plan a home birth, even if you transfer into hospital, the chance of you needing to have those things is lower.
Absolutely.
And I'm not sure what the reason is. I think it's probably a mindset. You go into labour at home, you know this is on you. I'm going to do this. I'm not going to hospital for someone to take this baby away out of me. I have got to do this. I've got to give birth. It's a process that I've got to go through. And I think that mindset is a massive difference. So it does reduce your risk of needing a cesarean because you're more mobile and you want to have an active and you want to participate in your labour rather than labour be done to you. So I think that makes a difference with the cesareans, forceps, ventouse, that kind of thing. With regards to infection, you're in your own environment. So it's your own bacteria that your body knows. It's not alien bacteria. So yes, you are much less likely to have an infection. We do stitches at home if we can. Most stitches we can do at home. And it's very, very rare for them to get an infection because there's no alien bacteria. Whereas in hospital, there is much more chance that you will get an infection after having your stitches done because there's so many people there and it's not your normal household bacteria that your body's used to. With regards to the postpartum hemorrhage, that's again oxytocin. Oxytocin contracts your uterus after you've given birth and causes or slows down the bleeding. Once your placenta's out, it slows down your bleeding, and it makes your uterus clamp down and reduces your risk of a postpartum hemorrhage. So if oxytocin is still flowing, you're just lying there, you're just cuddling your baby, getting to know your baby, and no one's interfering with that, chances of having a postpartum hemorrhage do decrease. And with regards to third and fourth degree tears, so really serious tears, they can happen occasionally, but mostly, again, women are choosing to be in whatever position they want to give birth. It's very rare someone gives birth lying on their back on their bed. Most people are upright and mobile, and being in a position that you choose to give birth in, and not having someone tell you to push, and someone support you to breathe your baby out rather than push, reduces your chance of tearing badly. So less than 50% of the women that we care for every month require any kind of stitches.
And that's all facilitated by being in an environment that is nurturing of those hormones, of movement, of normal physiology. So for those who are listening and you don't know what the term physiology means, it basically just means what's naturally supposed to happen within the body, what the body's natural behavior or process is of doing. And in this case, we're talking about labor. I'm going to just take a moment to explain to you why I had agreed to do these shows on Ramadan Radio to make it relevant in terms of spirituality. And the reason behind it is because when I look at the choices that people are making, a lot of them are often out of fear or out of not being fully informed about the consequences of the choices that they're making. And as a midwife, it's my complete duty and responsibility to ensure that someone has all the information when you're helping someone to make a decision. And the thing that I'm seeing more and more of is that people are making decisions out of fear and out of not misinformation entirely, but there's so much of information available out there that isn't readily accessible. You often have to look quite deeply for these kinds of information, for this kind of information. But as a Muslim ummah, we are responsible for our health. And I know that there's been talks about, taking responsibility for our health. And I think that by understanding what your choices are for birth in terms of where you give birth, it's one of the most important choices that you will make as a expectant mother, expectant parent. And I think that we need to pay more attention to what's available out there and be able to make better decisions for us as believers, as Muslims. And I think that's because how we give birth does matter. How we give birth can affect the choices that we have when it comes to feeding our baby, because the hormones, the chemicals, the drugs that we have in labour can often impact on the hormones that are then needed for feeding. So as Helena was saying, having your baby on your chest skin whilst, other things are happening around you at your birth will really impact on getting baby acquainted to you, getting to know your baby, getting baby to the place where it needs to feed. So it's really important to think about where you'll give birth. And even if you decide not to have a home birth, it's about thinking about all these things we're talking about home birth, that you can then use to create your birth space within a hospital space as well, because it's all about nurturing physiology. So if your situation changes, if you needed to be transferred to the hospital, the mindset that you're already in is, okay, I'm not at home anymore, but I can have the lights down low. I can have the aromatherapy going. I can have, I can be using breathing techniques. I'm using my TENS machine. I can go into the pool if it's appropriate. So these things are things that we should be thinking about, including within our preferences, within our plans. And yes, you can't plan the eventuality of one's birth. However, if you're prepared for any eventuality, then you can support your physiology, things that are naturally occurring, and then the processes that are naturally occurring, to then have a more positive experience.
Absolutely.
So my next question to you will be, with the risk. So we talk a lot about risk within our jobs, and it's always risk assessment this, risk assessment that. what are the risks to a home birth? Because people will always be a bit sceptical about it as a choice.
Absolutely. There's not a lot of risk to a home birth. There's no increased risk to a home birth. The only thing is, if something really unexpected happens, which is very, very rare, but occasionally unexpected happens at any point, doesn't it? So if the unexpected happens and we needed to get an ambulance there quickly, obviously being at home would delay medical care. We would have to transfer in. However, as I said before, we're really highly trained to deal with pretty much anything birth can throw at us. But there are certain drugs and things in hospital which would need to be administered by a doctor. So that's really the only sort of risk of a home birth. And obviously it depends on each person individually. So everybody's got their own health issues. And so what we say about the stats we give out about home birth, we know that home birth is safe for women who are healthy and well and have a healthy and well pregnancy, whether it's your first pregnancy or your second or third. But there are some women who have extra health issues, or their pregnancy has extra health issues. And rather than saying, no, you can't have a home birth, what we say is, let's have a conversation with us, potentially with an obstetric consultant as well, to discuss what your individual risk is. Is being at home the safest place for you? Or do you feel that actually being in hospital will increase your anxiety, so you won't labour as well? So maybe being at home, even though there are some extra risk factors, is still a best place for you. So we would never recommend a home birth for someone who's had a previous cesarean. But a lot of our women, or some of our women, have had a previous cesarean. We've spoken to them about the slight increase in risk of certain things and what we would do in those circumstances. They've made the decision and they have chosen to stay at home, and many of them have had successful home births. And
that's just it, isn't it? That the risk is perceived risk. So it's your perception of the risk.
Absolutely.
Because for someone, that 0.02% or that 0.2% of a uterine rupture in terms of someone trying to have a birth after having had a previous cesarean is too much of a risk to take, and they would feel safer in a hospital.
Indeed.
And that's absolutely fine.
Yeah.
But at the same time, that same risk to another person may be quite low.
Yeah.
And it's about understanding those risks. So to clarify, women who are deemed as being higher risk can still be supported to have a home birth here in Leicester.
Yes, they can. Yes. So we would look at you individually.
Yep.
So we'd have a conversation with you. So no one can say you can't have a home birth. We can't drag you kicking and screaming out of your house. And sometimes we would say we really, really wouldn't advise this. If you continue and you want to continue with the home birth, then we will put a plan in place to try and make it as safe as we possibly can. But as I say, most women will, there are things we do, and most things we do will cover a lot of risk circumstances, if that makes sense.
Brilliant. So I actually had posted on Instagram on my account to say that if there was anyone who was interested in a little giveaway, then we were going to be giving out labour combs. Have you seen labour combs being used, Helena?
Lots and lots of people use labour combs. Yeah, they hold them in the hand, and it I think it stimulates some nerves in your hand, which basically sort of distracts you from the discomfort of labour, the pain of labour.
So Helena, see them in action, guys.
Yeah.
But I've had a message from a really lovely lady who's actually thinking of booking in for a home birth, given the chance next time. She said she's listening in with her mum, and her mum's horrified, so she's really interested. So Yasmin, I'm going to say you can actually have one of these combs for next time then, because I said that I would be giving 3 away for this show.
Fabulous.
So Yasmin, you can have one of them. I'll either drop it to you, or you can message and collect it from the studio if it's easier. So yeah, we've still got a little bit of time left for the show. If you would like to send in a question to be in a chance of winning one of the labour combs, then please listen out for these instructions.
Call in on our studio number, which is 0116 4822 086. Or text in at 077 488 55055.
So Helena, with regards to your work, what's the favourite part? What's the most the best part of your job?
Oh, wow. Being at a birth. So I went to a house the other day. We do shifts, and I went to take over on the night shift from a colleague who'd been there in the day. And I knocked the door, and my colleague answered, and she just had a big smile on her face. And I said, "The baby's here, isn't it?" And she went, "Yeah." Oh, it was so lovely. And everyone was crying. And Dad was crying, Mum was crying, the midwives were crying. And it's just, sometimes you just get that wonderful, this has just been an amazing experience, and we're so lucky to be involved in it. So that is actually the real crux of it. But sometimes just getting to know the women that we care for, and then we're not always at the births of the women in our areas, unfortunately, because we work shifts. But we are so lucky when we do get to attend the birth of women that we've cared for. Last year, it was incredible. I had 2 women who lived on the same street, who were due quite close to each other. I wasn't even working, but I was working an extra shift for a different area, and one of the ladies went into labour, and they said, "Oh, you go to that, and another midwife can take over the work you were doing." So I went, cared for her, had a wonderful home birth, which was amazing. A week later, her neighbour went into labour, and I was the midwife there as well. So I've been at the birth of 2 babies on the same street. Yeah, within a week of each other. So to have that continuity, to be able to get to know someone, for you to walk into a room and then go, "Oh, Helena's here, it's all right." Rather than, "Oh, I've got to meet someone new and I need to make a connection." And people, the calmness of being able to walk in and go, "Oh, yeah, I know who this midwife is that's walking in, and I trust her." That is incredible from the midwife's point of view.
I think it's really special to be able to build up that relationship with women and care for them through absolutely everything, because there'll be things that you'll see during her pregnancy. You might see her go through a bit of a rough time because she's sort of struggling to deal with some, XYZ or some sort of situation. But then to see her when she sees you and knows that, "Oh, I can let go. I don't need to worry about where my husband is or where the kids."
Yeah.
That's that's all. Helena's here, she'll take care of it, kind of thing. Everything will be okay because she's here, and that's a lot of
responsibility.
Absolutely.
But it's very special to have to be able to engender that trust in people. It's a really incredible part of the job.
One more question for you is, I'm going to there's a lot of apprehension around home birth, I guess, for so many different reasons. But what do people need to be aware of when considering a home birth? So what are the sort of logistics of a home birth?
Okie doke. So as I said before, have a bag packed, because then we know where everything is and it's all available. If you are having a pull from us, then you would need to get the hose and liner, and the midwife who's seeing you would explain how you do that. We would get... We'd recommend that you get some plastic sheeting, because then you can give birth on the plastic sheeting, and we scoop it up and put it in the bin. People are very concerned about mess with a home birth, and actually there's very, very little mess. We always pride ourselves on leaving everything a little bit tidier than when we arrived. I've got a colleague, Claire, who will be cleaning up under my feet quite regularly. I'm not the tidiest, unfortunately. There's not... there's not a load of mess. I think people expect some kind of, bloodbath kind of thing, and it really isn't like that. The other thing to consider is children and wider family. So if your children are there, often they're still in bed. If it's at night, they're still in bed. They'll wake up in the morning and have a new sibling, which is incredible, seeing those children all muzzy coming down in the morning in their pyjamas and meeting their new sibling, which is wonderful. But it's always sensible to have someone available. If you've got the children in the house, have someone else available, a grandparent or something, who can either take them away if they're waking up, or who can be there to support them. So for my home birth, my 3-year-old was there, but her granny was there with her as well. So she was able to take her away. She didn't have to be there and watch if she didn't want to. So that's really helpful as well. So you don't want to be thinking, "Oh, what's happening with the baby, with the children, and am I making too much noise? Am I going to scare them?" So sometimes we do recommend preparing those children, watching some really nice home birth videos on YouTube or something, if they're going to be around when baby's being born. Also, because we might need to transfer to hospital, we never know. So always have a contingency plan for your children as well. And be able to get yourself or your partner to hospital, have that plan in place. So if we did need to transfer, the partners usually can't come in the ambulance because the midwife's in there, so we ask them to come along separate. So if you've got your car or you've got someone who can give the partner a lift, just a little bit of a plan in place so you know you're not having to worry about anything.
Real. We've actually got a question come in. So we've got Assalamu alaikum Tasneem and Helena. Loving all this information about home birth and making women aware of their choices. It's so needed in our communities. Just a quick question. Why do you think there are less BAME home births than women from white or other backgrounds, even though most of our parents had home births because hospitals weren't accessible or it was not the norm to give birth in hospital?
I'm not sure. I wonder whether it's because your parents didn't have the opportunity potentially to go to hospital, maybe because it was a funding thing or, cost implication. So actually going to hospital is a bit more of it's seen as a safer thing because, it's available. We didn't have that when we were young, so use what you've got now that you've got it available. It could be that. I don't know. What do you think? I
think it's, I know like in some of the sort of more middle class Caucasian areas within Leicester, I think there's a wider sort of education around the different choices of where to give birth. Those women are often accessing, substantive antenatal classes that can then help them. Although I don't think we're limited here in Leicester. No. I think that it's maybe just that people aren't aware of where to find the information. Yeah. So I am going to ask you about how they can contact you. Yep. We've got another a message come through, which is Salams Tasneem, lovely to hear you and Helena on the Ramadan radio show. Helena was part of my antenatal care for my firstborn. Hi Helena, hope you're well.
Hi.
Just want to say you are amazing for raising awareness. It's so lovely to hear from you both and talk about the risks and the pros and cons and the not so many cons of the home birth. And I'm going to say you might be shy, Fatima, and I know that you were scared of coming and speaking on the radio, but you know what, Habiba and Fatima, you both have taken the remaining 2 labour combs, and I know you're both expecting. So as someone who attended Mama's Inc. session, I agree with Helena. It's so important to learn about how our bodies birth and knowing your rights. Taz's course is incredible at preparing you for all the possible outcomes and it allows you to make educated decisions if need be. I'm forever grateful to her for her help and I learned so much, which I didn't get as part of my routine midwife appointments. Thank you. Oh. Shame you didn't leave your name on that one. I could have personally shouted you out. That's absolutely brilliant. So we've had some really sort of lovely comments around the home birth team and what you do. So if someone who's listening to the show wants to contact you, how are they able to do that?
So just give us a call. So as I say, Daniel's in our office Monday to Friday, 9 to 5 most of the time. Our number is 0116 258 3425. It is in the front of your handheld notes. Mm-hmm. It's not correct though. There's a random 6 in there. They keep reprinting it with the wrong number in there. But you can, the random 6 in the middle there is not correct.
I always look at it and I think, I can't remember what the number is, so just Google them or you can end up, calling the wrong number. And sometimes I tell them to ring the other number, but that's the labour line, isn't it? Yeah,
don't ring the mobile number because that is the number that we ring. We ask people to ring for labour. We've also got Instagram and we've got a Facebook page. Mm-hmm. Instagram is UHL Home Birth Team and we post monthly stats on there so you can see what we've been up to that month. And Facebook is University Hospitals of Leicester Home Birth Team.
Brilliant. I want to thank you all, Jazakallah khair, for tuning in to the show today. I will be back next Thursday and I will be talking to a mum who's actually had a home birth, booked for home birth for the first but transferred in, and she's currently planning her 3rd home birth. Wonderful. So hopefully, given that baby is still in position, she'll be joining us next week so we can talk about it from a woman's perspective of the experience of having a home birth. Remember me in your du'as, inshallah. We'll join me next week to talk.